Hi, my name is Robert Gleeson and I'm one of the orthopaedic surgeons at Cheltenham and Gloucester. I'm here to help describe to you the Cheltenham Elective Orthopaedic Centre and to help you prepare yourself for your forthcoming trip to our hospital where you may well be having assessment for joint replacement surgery. So I'm going to try and help you familiarise you with the unit and actually what will happen on the day of your surgery.
Hello, Mr. Parkinson.
Hello.
My name's James Peggham. I'm one of the orthopaedic consultants.
In your outpatient clinic, you're going to see one of our orthopaedic colleagues and we're going to discuss with you your symptoms and what impact they're having on your life, and you can describe them in full detail. It may be that you've had previous injuries and those are all relevant, and of course we'll want to understand what treatments you've already tried. We'll be asking you about pain relief that you're currently on, and we're certainly going to be very interested to hear about your other medical problems to make sure they won't overly impact on the operation. Finally, we will be asking about lifestyle choices such as smoking, alcohol consumption and your diet, and what involvement you have in regular exercise. Of course, your knee or hip or whichever part of your body will be examined.
Okay, I'm just going to examine your knee next.
And we'll look at the range of movement in that joint, and this will help us formulate your treatment options.
You got any pain, discomfort on the back here at all?
No.
And on this side here at all?
Most patients will require an X-ray, further scan, perhaps a CT scan or even an MRI scan, and these will be arranged at your clinic appointment. You and your consultant will decide if an operation is indicated, and we'll describe in detail the process of that operation and what to expect. We'll talk to you about the recovery, we'll talk to you about the benefits of surgery obviously, but clearly we will talk about the risks. You may be asked to sign a consent form in the consultation clinic, but it might be that you sign it later. In terms of preparing for surgery, it's really important, if you are a smoker, that you stop as soon as you can, for as long as you can in the run-up to your surgery, and managing to lose weight before surgery can be incredibly helpful. You'll hear surgeons and nurses talk about the body mass index, and this is how we assess your weight relative to your height. Having strong muscles before your surgery will be incredibly helpful to you and, of course, to the physiotherapist. Some people do have chronic skin conditions such as psoriasis or eczema, and making sure that your skin is in the best possible condition by taking GP or dermatology advice in the run-up to your operation is really helpful. Finally, some people take it as a good time in the weeks before their operation to finally sort out the garden. Be really careful about this, as cuts and scratches can sometimes cause us to cancel your operation on the day of surgery, which is always a very disappointing outcome. Before coming into hospital, it's really helpful if you can organise things at home, making sure that your life when you return from the hospital will be as easy as possible. This might mean getting some additional food in the freezer and certainly removing obstacles that might cause you to trip or fall when you walk back in the house.
Hi Richard, welcome to Pre-Assessment. My job today is to make sure that you're fit and well to go ahead with your anaesthetic.
Assuming you've decided to go ahead with surgery, in the few weeks before your operation, you will be asked to attend Preoperative Assessment Clinic, sometimes called POAC. This is based in both Cheltenham and Gloucester. The aim of this is to get you ready for your anaesthetic and surgery, and it's run by our nursing team as well as supported by our anaesthetic doctor team. At that appointment, you'll definitely have some swabs taken, and it's possible that you may be advised to use a special wash and even a nose spray before your surgery. It's really important you follow these instructions carefully, as this helps to reduce the risk of developing a post-op infection. Standard measurements like your height, weight and blood pressure, as well as your ECG, will be recorded, and we do all of this, of course, to make sure you're in as good a condition as possible before your operation. Other chronic health conditions will be assessed and evaluated, and your medications clearly need to be looked at, and obviously some pills need to be stopped in the run-up to your operation. It'll be really helpful if you bring a list of all your medications so that we can look at that and advise you on whether any medications need to be stopped on the days before your surgery. You will be given an information leaflet to help you prepare for your operation, and a bag that contains some carbohydrate and protein drinks to aid your recovery. A very, very small number of people require blood transfusion after this operation, and so you may be asked for your consent to receive blood products if required in an emergency. One of the preoperative assessment nurses will be inquiring about who's going to collect you after your operation and will need their contact details. You will be asked to perform some neck movements, your airway will be assessed, and you'll be asked whether or not you have any loose teeth or dentures. All this is part of a standard assessment before having an anaesthetic. The day of your surgery is now approaching, and here are a few more things to think about to prepare you for that day. Make sure you have a good supply of paracetamol or ibuprofen at home. On the day of your operation, have a shower or a bath, and if this is not possible or difficult, then please shower the evening before and wear clean nightwear and have clean bed linen. There are lots of things to bring on the day of surgery. These include the medicines you normally take and a list of the doses for each medicine. Please bring your glasses or contact lenses with their case, and of course bring some night clothes as well as some slippers for daytime use. You can bring your toiletries and of course some entertainment such as books, magazines, tablets, and of course don't forget your chargers. A small amount of money for some healthy snacks is probably a good idea. On the day of surgery, if you're arriving by car, please park in the drop-off location at St Paul's Wing entrance. You can park here for up to 20 minutes. Your arranged person can walk into the orthopaedic unit and help you get settled, and there's also a lift available. The closest car park for long stays is the College Road Car Park 1, and if you would like your arranged person to stay with you for a little bit more time, this is the car park to use. You'll be greeted by one of the orthopaedic team and shown to your bed or trolley space. You will change into theatre gown and be given a hospital band. A warming blanket will be placed over you to prepare you for surgery. It can be quite busy in the morning rush hour. Please don't worry if there's a little bit of a wait. You can have sips of water until it's time to go to theatre. You'll definitely be seen by a member of the orthopaedic team who will ask you how you're feeling, confirm all your details, and check your vital signs. Don't worry, it's perfectly normal to be a little anxious at this stage. If you do have any allergies, you'll be given a red wristband and you'll be asked to confirm what you are allergic to. We will check your details repeatedly through the day, and this helps, of course, to reduce errors being made. On that morning, you'll be seen by your orthopaedic team who will confirm the consent and mark your limb with an arrow. If you've got any questions regarding the surgery or the recovery, that's the time to ask them. A lot of our patients go home on the same day of the operation, but please be reassured that we will only discharge you once you are safe and meet all our discharge criteria.
Hello, is it Richard Parkinson?
It is.
Hello,
Hi.
my name's Kath Sutherland. I'm one of the anaesthetic doctors here.
The anaesthetist who will stay with you throughout your surgery will visit and check on your medical history and run through a series of questions again. It will feel similar to the anaesthetic assessment that you had with the nurse in the pre-op clinic. The choice of anaesthetic will be discussed with you and the benefits of each different technique will be described. In general, most hip and knee surgery is performed under a spinal anaesthetic, which is an injection in your back that will make you numb from the waist down. Very often, this is combined with a regional block, which is injecting some local anaesthetic, usually under ultrasound guidance, around your nerves in the leg. Finally, during the operation, your surgeon often injects local anaesthetic into the wound at the time of the operation, which really does help with a longer lasting pain relief. You can be wide awake for your operation, or you may choose to have some sedation. If you are having a spinal anaesthetic and you'd like to bring some music with some headphones, that's absolutely fine and we would encourage that. Some patients may be more suitable for a general anaesthetic, but we do try and avoid this where possible. Your anaesthetist will help you decide which technique is the best for you. When it's finally time for you to go to theatre, one of our team will come and collect you. Once again, they'll confirm all of your details and check the surgical site has been marked. They'll also ask you about whether or not you've already got metal in your body, and of course repeat the questions about whether or not you've remained starved. You'll be given the opportunity to use the toilet and then you'll be walked through to our operating theatre. Before heading into theatre, you'll be taken to the patient's reception holding bay and given a surgical hat for theatre. Your temperature will be checked and the anaesthetist will greet you with their anaesthetic nurse assistant to reconfirm all your details once again.
We're just going to come and check your wristband and check your consent form. So,
Sure.
Can I just check that?
In the anaesthetic room, if you're having a spinal anaesthetic, you'll be asked to sit on the edge of a bed. The anaesthetic nurse will help support you whilst the spinal anaesthetic is performed. This involves a small injection in your back. In order to do this, your position is really important. You'll be asked to put your chin on your chest, relax your shoulders and lean forward. This helps open up the spaces in your back. Alcohol fluid is sprayed to clean your back, and this is really quite cold. Local anaesthetic will be put into the skin of your back and that can sting a bit, but then afterwards you really only should feel a bit of pressure. If you feel anything else, such as shooting pains in your leg or tingling, just let the anaesthetist know. Once the anaesthetic is administered, your bottom may feel warm and you may have a sensation of pins and needles in your legs, as well as a heaviness. Both the anaesthetist and the anaesthetic nurse will help you to lie down on the bed whilst the anaesthetic starts to work. A warming blanket will be placed over you to keep you warm, as it can get really cold in theatre. You will then be connected to routine monitoring equipment to keep a really close eye on you. You will be asked once more to confirm which leg is being operated on, and your consent form will be checked. We check the spinal anaesthetic is working by using a cold spray. The same nerves that carry the cold sensation also carry pain, so if you don't feel the cold, you won't feel any pain either. The anaesthetist won't let the surgeon start until they're entirely happy the spinal is working. After your spinal anaesthetic, the anaesthetist will then use an ultrasound machine to put some local anaesthetic around the nerves in your operated leg. This gives you long-lasting pain relief. If you wear glasses, these will be removed at this point. If you choose to have sedation, this will be started now, and you'll start to feel sleepy at this point, and you'll be given an oxygen mask to wear. If you brought music to listen to, you can have your headphones on at this point. The surgical team will then position you for your operation. Your spinal anaesthetic will be working by now, and none of this will be uncomfortable. If you're having knee surgery, you may well have a tourniquet applied to your leg, which helps to control blood flow during surgery. A protective barrier will then be applied over the tourniquet. Your leg may then be shaved and cleaned around the surgical site. Supports will be applied to the trolley to help position you for your surgery, and this depends on what kind of surgery you're having. Our patient in this video is being prepared for knee replacement surgery. You will now be wheeled into theatre to start your surgery. There'll be more people in theatre. It can feel busy, but everyone is there to keep you safe. For the final time before your surgery, the theatre team will check your details, wristband, allergies, and consent form before beginning the operation. Drapes will be placed over your body and like a curtain in front of you. If you're awake, you'll not be able to see what's going on, and the anaesthetic team will be next to you all the time. They can answer any question, reassure you if you're in any way anxious. Once the operation is complete, a dressing is placed over the wound, and sometimes a bandage may be applied. If you had sedation, it will be gently reduced, and you'll be slowly woken up and moved from the surgical trolley into a hospital bed. You'll then be taken to the recovery ward. You'll be taken to recovery to be monitored after your surgery. The recovery nurse will be told about your surgery and any relevant medical history. You'll have your observations monitored, and you'll be asked about whether or not you're experiencing any discomfort. You'll be monitored to assess when your spinal anaesthetic wears off. To assess this, you'll be asked to wiggle your toes and ask if sensation has returned to your legs. You'll have a finger prick test to assess if you're anemic. If this is within the normal range, most patients will not require further blood tests. You will also be given an energy drink to help you get up and do your physiotherapy exercise. When you're awake and comfortable, you'll be moved back to the ambulatory bay on the ward. You'll be given something to eat and drink. You'll be seen by the therapy team. They will help you get up and going as soon as possible following your surgery. The team try to let you do as much as possible without any assistance. They will take you to the therapy room where you'll be shown and then perform a series of exercises for you to complete regularly during your recovery. This includes a series of stretches and exercises such as assisted lunges and squats, and if possible, walking up and down stairs. All of these exercises are shown in the information booklet you were given at the preoperative assessment appointment. You will also be given appropriate walking aids by the therapy team who will show you how to use them. It's really important for you to do your exercises regularly and as instructed.
When you go home, it's really important to progress these exercises. We've just done 5 now. But when you get home, I want you to do them 3 to 4 times every day and gradually increase the number of exercises that you're doing.
When you're safe to be discharged, the nursing staff will provide you with a discharge summary and any medications that you're required to take home. There'll also be an information leaflet, a contact details sheet if you have any concerns, and a medication chart which shows all the medications you need to take and when. Please contact your GP surgery to make this appointment as soon as possible. You'll be given an additional dressing to take home. Your cannula will be removed before you're discharged. You are now ready to be discharged, and it's time to go home. You'll go home once your pain is under control and it's safe to do so. In the majority of cases, the expected length of stay is somewhere between 0 and 1 day. Pain relief can be provided to take home along with blood thinners. You'll be called on day 1 by the advanced nurse practitioner to check you're okay. If you have any problems, call the number for AMP in hours, wards out of hours. Please remember, the most important thing is to do your physiotherapy exercises. Thanks so much for taking the time to watch this video, and we hope you feel better prepared for your surgery. We'd like to thank the patient and his wife for giving up their time to help us make this educational video. We look forward to welcoming you on the day of your surgery.